Hello, good afternoon. My name is Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Today is a wonderful day, and today is our clinic in YouTube. And today's topic is very important for all women, especially if you're believing God to become a mother. It's important you understand fully well how to prevent developing hypertension if you're believing God to become a mother. It's important to understand that hypertension is a deadly killer. So it's a very important topic, and I'm going to sit back to give you an opportunity to announce your location and also your name. So I'm going to see who is around. So once you come in, you introduce yourself, you tell me where you're located, and you settle in so we can have meaningful conversation. After my presentation, you will have opportunity to ask your questions. I'm planning to spend about 30 minutes. So likely the first 15 minutes, then the second 15 minutes, I will use it to explain and take care of your questions. Please make yourself comfortable, make yourself at home while we wait for other people to join. Hypertension is a condition you need to understand better, especially if you're a woman. There are so many misconceptions out there, one of which is that hypertension, it's actually something that happens to men. Very wrong. Hypertension can also affect women, especially within your reproductive phase of life. So please make yourself comfortable, and as soon as you join, let me know who you are, your name, and we're going to get the clinic started any moment from now, okay? So just make yourself comfortable while I sort things out and make sure we are good. Okay? So thank you so much. Currently, nobody is in the clinic. I'm going to give a few more minutes, after which I'm going to start my presentation any which way. Immediately after this particular presentation, I'm going to repeat the same topic in Facebook. So if you're in our Facebook group, if you're in our Facebook page, please follow me to Facebook immediately after my presentation. So once you join, introduce yourself. Let me know who you are before I start. Okay? Thank you for coming. So far, no one has joined. That's very strange. At least we will normally have about one or few people join. So once you join, I need to know who you are. So please introduce yourself. Tell me where you're located. It's very important to me. Matter of fact, what I'm going to do, I'm just going to wait. Once one person joins, I'm going to start. Once I have an indication that at least one person is in the clinic, I'm going to start the clinic. Okay? Also, once it gets to 4 minutes and nobody has joined, I will start. Any which way, I'm going to start. Okay, so I have one person currently in the clinic. So high blood pressure is a condition that will actually put pressure on your heart to work harder. So high blood pressure is also referred to high BP or hypertension. This happens when the blood pressure and the force of blood flowing through your blood vessels, it's consistently high. I'm not going to go into all those medical details, but just know that when you have high blood pressure, your heart will be working against a lot of pressure in the vessels, in the arteries that combine to return and remove blood from your heart. So it's a condition that will definitely affect everything in your body. When high blood pressure is not diagnosed early and is not treated properly, high blood pressure can lead to heart attack. High blood pressure can lead to stroke. High blood pressure can lead to kidney failure. High blood pressure can lead to liver failure, eye damage, heart failure, buildup of fatty tissues in your vessels called atherosclerosis. Any of the conditions I mentioned can be as a result of poorly controlled high blood pressure. Now, there is a big misconception out there regarding high blood pressure and hypertension. So many people believe that high blood pressure is only something that affects men. That's not true. High blood pressure represents about 52% of things that kill women every year. So it's a deadly killer. So the misconception that high blood pressure rarely affects women, it's completely wrong. Now, half of all the adults that will have high blood pressure are women. So think about that. So women are very, very important when we talk about high blood pressure, especially if you're within your reproductive phase of life. That means if you're within your childbearing age. Childbearing age is the age by the time you start releasing your egg and before you enter menopause. Most women about this age bracket, unfortunately, might likely develop high blood pressure. Now, there are a couple of things that will predispose you to developing high blood pressure, even when you don't know. If you recently added a lot of body weight to the extent of about 20 pounds more, and you're overweight or you have obesity, that's a big risk factor. Unfortunately, women that want to get pregnant have this problem. So if you recently plugged in your numbers and your BMI is not telling you the truth, you have a risk factor of developing high blood pressure. Be careful. If you have a family history of high blood pressure, that means your mom, your dad, or your sibling have high blood pressure. You have an important risk factor of developing high blood pressure. If you're recently perimenopausal or you're tending towards menopause, that means you no longer have the ability to become pregnant by yourself. That's also a risk factor. So the older a woman is, the more the possibility she will develop high blood pressure. Now, the major problem of high blood pressure among women that want to have their babies is the possibility of affecting your pregnancy. So some women will not have any blood pressure problems until they become pregnant. So they develop high blood pressure during pregnancy. Unfortunately, it can lead to complications in your pregnancy, which we call preeclampsia. Preeclampsia is characterized by onset of high blood pressure that will last and lead to a couple of complications. In America, preeclampsia will affect 1 in 25 pregnancies. And if we don't deal with it appropriately, it's very, very deadly. Now, the question is, now we know all this. What can we do to prevent high blood pressure, especially among women of childbearing age? It's important to understand that it's actually a big challenge because we keep hearing about new cases of, diagnosed blood pressure. And also coming from our experience, our culture, our religion, so many people believe that once they pray, they can pray high blood pressure away, and it's not their portion. So essential hypertension remains one of the most common diagnoses among women. So whenever I say hypertension and high blood pressure, they are the same thing. Now, unfortunately, hypertensive disorder of pregnancy are frequent and they can kill. They can lead to problems, they can lead to miscarriage, they can lead to stillbirth, they can lead to disorder in your baby and the woman. So it's very important we control this. Early recognition and prompt management by so many disciplines, like obstetrics, like cardiology, like endocrinology, will help us to prevent bad outcome of high blood pressure in women. Now, thankfully, there are things we can do to prevent developing high blood pressure among women. So everything will center around your lifestyle modification. Matter of fact, if you do well and if you're disciplined, you can actually stop taking any blood pressure medication. Unfortunately, when you have high blood pressure, it's a condition you're going to live with for the rest of your life. But if you do well, you can live with high blood pressure by modifying your lifestyle. So what are those things women can actually do to prevent developing high blood pressure? Number one, your diet. You have to eat right. If you can eat right, then you might have a possibility of preventing developing high blood pressure. So to manage your blood pressure, you should first of all, this one, everybody can practice this, limit your consumption of salt. So both raw salt and the salt you use in cooking your food, limit your consumption of salt. Salt is a culprit in predisposing you to developing blood pressure because salt will retain a lot of fluid, a lot of water, and a lot of water and a lot of fluid can put a pressure on your body and you can develop high blood pressure. So limit your consumption of salt, which contains sodium. Then please consume more food which contains potassium. So potassium is the enemy of sodium. So when you consume a lot of salt, you are increasing the sodium level of your body and you're reducing the potassium level of your body, and that's not good. So an example of healthy food you can eat Eat food that are lower in fats. Eat a lot of fruits. Eat a lot of vegetables. Eat a lot of grains. An example of diet you can eat is DASH diet. Very good. It will help you to control your blood pressure. Number two, you have to start exercising immediately. Regular exercise is very important for women that want to become mothers, because when you exercise regularly, it will help you to maintain your healthy body weight. When you maintain your healthy body weight, your blood pressure will regularize. So you should try to get your moderate intensity aerobic exercise at least 2.5 hours per week, which, if you really want to be committed, 30 minutes every day. Then you can have a couple of days for break. But worst case scenario, 2.5 hours of moderate intensity aerobic exercise or vigorous exercise for 1 hour and 15 minutes per week. It's not asking too much. Excuse me. You can do this. So exercise is very important if you want to avoid developing hypertension. So when you eat right, eat more fruits, eat more vegetables, eat more whole grains, watch your calorie intake, even consider going on intermittent fasting, it will help you. But you need to exercise. There are so many forms of exercises you can engage in. You can go for walk, you can go for swim, you can dance, you can hop, you can go for bicycling. Anything that keeps you going is very good. Now, when you're done doing that, you have to remember that your body weight is important. So you have to be conversant on how to calculate your BMI, body mass index, which is a formula that will help you to know if your body weight is within normal range. So being overweight or having obesity will definitely increase your possibility of having high blood pressure. Unfortunately, when you develop this, it will also affect your fertility. So women that want to become pregnant that develop hypertension will likely develop diabetes, will likely have obesity, and diabetes and hypertension and obesity will also affect your fertility. So at the end of the day, you don't need any of these negatives. So mind your body weight. When you control your body weight, you can control your blood pressure. And when you control your blood pressure, then you can ward off diabetes and your fertility will improve. Limit your alcohol intake or possibly stop completely. If I were you, I will stop completely. You don't need all those alcohol. There is no useful thing that alcohol does in your body except giving you fake assurance. So limit your consumption of alcohol. When you drink a lot of alcohol, you're predisposing yourself to developing high blood pressure. So it adds extra calories, which will also lead to you adding a lot of body weight. So men, worst case scenario, don't take more than 2 drinks per day. Women, just 1. But if you ask me, stop completely. Definitely, you don't have any business smoking. When you smoke, both as a primary smoker or a secondary smoker, you are increasing the possibility of developing high blood pressure, which will also predispose you to developing strokes and heart attack. So do not smoke. If you're smoking, please stop. If you are not, don't start. If you're having problems stopping, please call your doctor so your doctor can help you. You have to manage stress. This is an area that so many women are not doing well. So many women actually create stress for themselves. Things that cause a lot of stress for you, please leave that particular thing. There are certain things you can't help doing every day. Like if you live in Lagos, you definitely have to be in that traffic. That traffic can cause you a lot of stress. I understand that. But there are some avoidable stress that will lead to possibility of increasing your chances of developing blood pressure. Avoid them. Anything that will cause you stress, avoid them. So manage your stress. You can develop a couple of techniques that will help you to manage your stress. You definitely go for exercising. Listen to good music. Focus on something calm and peaceful. Meditation helps. Mind the company you keep. There are some people that will actually predispose you to developing high blood pressure because they don't want the best for you. So the company you keep can also predispose you to developing high blood pressure. So here's the deal. If you already have high blood pressure, it's important you prevent it from getting worse by going to your doctor so we can manage you appropriately. If you have not developed high blood pressure, please manage and make sure that everything I've already advised you to do today, you do them. Your lifestyle is very important. If you can do all this, you will be on your way to developing a very good, healthy attitude so that you can become pregnant and have your babies the way God planned you to have your babies. So that's my presentation. Right now, I'm going to give you an opportunity to ask your questions. And I have my two favorite people in the clinic, Tosin and Onyi. So please, if you have any questions, feel free and ask your questions. The clinic is open. We're probably going to spend about 5 minutes because we don't have a lot of people in the clinic. But Onyi and Tosin, if you guys have any questions, feel free and ask so we can get the clinic done. Immediately after this clinic, please follow me to Facebook. I'm going to repeat this topic in our Facebook page. So the clinic is open now. Please start asking your questions. In the next 5 minutes, you will have opportunity to ask questions and get feedbacks from me. Ask your questions, please. Okay? I'm waiting for your questions. Please feel free to ask your questions. I'm going to give 2 more minutes. If we don't have any questions, then we adjourn the clinic. If you have any questions whatsoever, even if it's not related to this topic, still feel free and ask. Which one is more dangerous, high blood pressure or low blood pressure? They are both deadly. However, you can fare better with managing high blood pressure compared to low blood pressure. Low blood pressure can quickly put you to shock, and when you go into shock, you're practically gone. So high blood pressure and low blood pressure are both medical conditions you should be aware of. When you have low blood pressure, it means you're practically getting ready to enter shock. When you enter shock, it's bye-bye for you. So both of them are very, very important, and they need to be diagnosed and they need to be immediately managed so you can have an opportunity of living. So low blood pressure and high blood pressure, they are both deadly. Okay, what are the odds of having a baby with heart defect? When you have high blood pressure, very high odds, because guess what? High blood pressure can damage a lot of things in the baby based on what happened to the woman. So if a woman has high blood pressure that was not controlled, she can develop preeclampsia. Preeclampsia is a condition that can damage a lot of your organs because in preeclampsia, there are 3 things we focus on: your blood pressure, presence of protein in your urine, and generalized body swelling. Now, when you have all this, your metabolism, the way your body works, the way your heart works, the way your kidney works, the way your liver works, the way your blood works, the way your hormones work will be affected. And anything that affects a pregnant woman can lead to disorder in the baby. So the answer is yes. Matter of fact, a woman that has preeclampsia, which is hypertensive crisis in pregnancy, can easily have miscarriage, can easily have stillbirth, can have a lot of complications in pregnancy. So we don't even want you to develop that. If you are already hypertensive before you become pregnant, we must make sure that your blood pressure is controlled before becoming pregnant, because blood pressure is a deadly killer. I love that question. Yes, the odds of your baby developing heart defect is very high. Okay? Can a woman with heart problem get pregnant easily? No. Okay? Now, the reason is because high blood pressure, if it affects your heart is at the center of everything. If your heart is sick, everything in your body will be affected. So if you have a heart condition, definitely even your reproductive system will be affected, because if your heart is sick and it's not pumping enough blood, then nothing will function in your body. However, if you have isolated heart problems, which were not diagnosed, you can still become pregnant. But the problem is, it can kill you anytime. So anytime you have any heart problems, it's important we diagnose it early, because there are so many complications that can happen when you have heart problems, because your heart is at the center of your functionality. Once your heart is sick, your whole body is paralyzed. So it can be a case of yes or no, depending on the level of that heart defect you have. I love that question. It's very technical. Apart from walking, what kind of exercise can help with fertility? all moderate exercises, running, swimming, dancing, bicycling, and going to the gym to do a couple of weights, going to your treadmill, they are all forms of exercise that will help you when you are planning to have a baby. Please don't go overboard regarding exercise. High intensity and stressful exercise will affect you negatively. When we tell you to exercise, make sure it's moderate exercise. Don't go overboard. When you go overboard, it's going to affect you and you will continue to have infertility. So be mindful the type of exercise you engage in when you are planning to become pregnant. Don't go for extreme, stressful exercise. Moderate intensity aerobic exercise is what you need to engage in. Can one have a baby if she have cardiomyopathy? Correct. So cardiomyopathy means pretty much a sick heart. And cardiomyopathy can be congenital cardiomyopathy or acquired cardiomyopathy. So if you have that, definitely you're going to have a couple of complications. But like I said, some women might actually find out they have heart disease and heart problems during pregnancy because pregnancy will tend to go and bring up a lot of things that are hiding. So if you have cardiomyopathy, of which one of the representation of cardiomyopathy is cardiomegaly, that means your heart is enlarged. We need to diagnose that and see what we can do to control that. So it will not stop you from having your pregnancy, but it can complicate the outcome of your pregnancy. Onyi, it seems you're going nuclear this afternoon. You really want to be a medical student, right? All your questions are very, very highly technical. Please keep asking your questions. You still have 1 or few minutes before I go. Actually, you have 9 minutes, but if we don't have enough questions, we can adjourn the clinic. Remember to register for the event coming up on July the 30th. Gynecological disorders. If you have any of the gynecological disorders, definitely they might lead to infertility. We want to tackle it. We have a professor, a sound professor of OBGYN, who will be our guest on the 30th, which is a Sunday, 9 p.m. Nigerian time. If you have not been able to become pregnant, I want to invite you to fellowship with us on that day, and you will have no regrets. Okay? Do we have any other further questions? I'm here to attend to your questions, so please feel free to ask your questions. Currently, we only have 3 people in the clinic. Ajuma Edime, I can see you. Make sure you attend all my clinics. If you're under my care, if you're my subscriber, the more you attend my clinics, the better for you. Because the more you attend, the more you're going to learn. So Ajuma Edime, it's good to see you. It's good to know you followed up to my instructions. But please keep asking your questions. If you have further questions, ask. Even if the questions are not related to hypertension, feel free and ask. Okay. Which of the numbers does the doctor focus on during BP, systolic or diastolic? Both numbers are very important. Tosi is asking a very important question. So the number on top, very important. The number below, very important. Now, some women can have what we call isolated systolic high blood pressure. Isolated systolic high blood pressure means the number on top is very high, higher than 140. But the number on the bottom might be normal. So you have isolated systolic high blood pressure. So systolic is the number on top. Diastolic is the number below. Some women can have combined systolic and diastolic high blood pressure when your blood pressure is consistently above 140/90. I'm just going to use that number arbitrarily. So when you check your blood pressure and they are consistently higher than 140/90, you have hypertension. So there are some conditions that we will notice the increase in number in the diastolic. Diastolic is the number below. So if your number below is higher than 90, we are worried. If your number on top is higher than 140, we are worried, especially if you want to start your family. So we actually focus on those 2 numbers, not just any. Okay? Ajuma Edime, keep asking your questions. Okay? Do IVF babies have more heart problems? There is no study that actually confirms that. Babies that came through IVF pretty much have the same potentials with babies that were born naturally. So there is no study that said, oh, if you have a baby with a baby that came in through IVF, they will have more heart problems. There is no study that have supported that. Okay? All right, keep asking your questions. These are very, very technical questions. Matter of fact, I actually love the questions you guys are asking this afternoon. Very, very technical. But please start asking your question. I'm actually very impressed with Tosi regarding knowing what the diastolic and systolic is. Very smart lady. Very impressed, Tosi. Keep asking your questions, please. You have about 5 more minutes. So everybody in the clinic, if you don't ask, I'm going to ask you. So if you're not asking me right now, I'm going to ask you based on what I've taught today. So I'm going to ask, and if you know the answer, please tell me. Now, the theory that high blood pressure is only limited to men, is it true or false? Is it only men that can have high blood pressure? What is the percentage of women in our society that have high blood pressure compared to women? Can kiddies also suffer high blood pressure? Can a newborn have high blood pressure? Can an elderly person have high blood pressure? Please, if you know the answers, please keep giving me feedback. Of course, it's false. High blood pressure is not only limited to men. High blood pressure also affects women. And high blood pressure can affect kids. It can affect adolescents. It can affect anybody. So there is no particular people that high blood pressure will only affect. Okay? Correct. Kiddies can also have high blood pressure. Youths can also have high blood pressure. And that's a type of deadly high blood pressure because it might mean a systemic problem. But if there is no particular thing that, and unfortunately, as of today, we don't know the exact cause of high blood pressure. We know the risk factors, but we don't know exactly this is what causes high blood pressure. We can tell you this is the risk factor, just like diabetes. We don't know exactly what causes diabetes, but we know the risk factors. That's medical practice for you. When we don't know, we don't know. Correct. Tosi is a very smart lady, 52%. Unfortunately, 52% of women that develop high blood pressure will have mortality every year. So that's a very high number. And the reason why they can have complications and they can actually die is because most women will say, oh, high blood pressure is not my portion. I cover myself, I cover my family with the blood of Jesus, which is okay. But you need to make it a point of duty to follow instructions from your doctors. When you go for your regular well-woman check, we must check your blood pressure. So let me ask you, how many of us in the clinic today have recently checked their blood pressure? I can see the 3 of you. So if you have checked your blood pressure lately, please let me know the numbers. If you have not, then you're going to be in trouble. Normal high blood pressure, I want you to focus on below 140/90. There are modern definitions, which I'm not going to bother you, but I'm going to give you a safe number. Make sure your number on top, it's not more than 140. Make sure your number below is not more than 90. Number on top is called systolic. Number below is called diastolic. So systolic below 140. Diastolic below 90. If you notice, the number on top is always higher than the number below. Of course, make sure the number on top, it's not below 90. And make sure the number below, it's not below 50. When you have a number below 90 on top and below 50 is low blood pressure, which is also deadly. Okay? Does hydration have effect on air quality? Of course. The more hydrated you are, the possibility your air quality will be the way God planned it. But if you suffer dehydration, it's going to affect a lot of your bodily function. So yes, make it a point of duty to drink a lot of water. Remember that your air quality is originally determined by your age. So as you're getting older, the quantity and the quality of your eggs will be reducing by default. But there are certain things you will do that will facilitate making your egg, which is already depleting, more poor quality. When you don't drink a lot of water, You're predisposing yourself to developing a lot of metabolic problems, including something that will affect your fertility. Tosi, you've checked your number is 10473. Perfect number. I love that number. Please keep it up. Okay? Onyi, I need your number. Ajuma Edime, I know you recently saw your doctor, so I also need your number. Once we have the numbers, we're going to end the clinic. Make sure you join me in Facebook immediately. Onyi, I need your number. Idime, I need your number. Your last blood pressure, please. Okay? Let's go, guys. Where are your numbers? Onyi, where are you? Edime, I need your last blood pressure from your doctor, please. Will you mind? And Tosi, I'm so impressed with your knowledge about high blood pressure. Very, very impressed. Very impressed. Keep it up. Okay, guys. Okay, I think you guys are now forthcoming. So thank you for coming this evening. I truly appreciate you. My next clinic in YouTube will be on Tuesday, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. Make sure you come on time. If today is the first day of watching my video in YouTube, I truly appreciate you. To make sure you catch up with my subsequent videos and teachings, click on the subscription button. Click on your notifications so that anytime I want to come live, they will notify you and you can join me live. Thank you so much and appreciate you guys. And please join me in Facebook so we can continue our conversation. Until I see you guys, God bless you and bye-bye.